So I want to say good afternoon to you. It's still morning here. I'm coming to you today from the ancestral territory of the Coast Salish peoples, the Squamish, the Tsleil-Waututh, and the Musqueam people. And I feel very privileged to be able to work and play on this land and to be able to share some thoughts and feelings that I have about outcomes, which tends to always either scare people or attract some really great people to these conversations. I really want to thank the organizing committee for inviting me and for bringing together such an interesting group of sessions for this conversation. For those of you who don't know me, my name is Skye. I am an assistant professor at the University of British Columbia in the Department of Occupational Science and Occupational Therapy. I'm a registered occupational therapist and work specifically in the youth space for approximately 17 years now, 17 years, July 1st. And I am the head scientist in an organization called Foundry, which I'll talk about a little bit today. And some of my past and present Foundry peers are online, so I just want to say hello to them and shout out before I forget. So this talk is a long title, and not usually my thing to do long titles, but Outcomes 2020 was the hashtag Outcomes 2020 was the initial title on its own. And I think we've heard a lot of people this year just talk about how they wish 2020 would go away and we'd start again. And it's been quite a challenging year for many people. However, it's also been an opportunity to really think about where we're at, where we're going, and how we want to get there. And in terms of youth mental health and the health of families and all of Canadians, we really want to look at this as a potential opportunity to lead globally in how we work with young people and families to be able to understand what their needs are, not only during this pandemic time, but in general, and then to be able to really take the time to thoughtfully and intentionally create the services that meet the needs of young people immediately, in the short term, and in the long term. So I believe that everyone came to this call, or I'm hoping they came to this call, because everyone in this virtual room that we're in today is here to challenge the status quo. And I believe that we think differently than others, and we desperately need this unified language of outcomes to grow and sustain the work that we're all trying to do across the country, whether you're in Alberta or whether in British Columbia or up north or on the East Coast. We desperately need to collectively come together. And that's kind of what I put in yellow is we're breaking the silence, but I also want to break the silence on bad data habits and why we can change this and why this is such an excellent time to change this right now. And I think the way in which we challenge the status quo is measuring outcomes in a systematic, youth-centered, and meaningful way. And that's really what this talk is about. I have my buddy Amber who will be managing the chat, and it's just a bit of a difficult two-screen platform. So I have 4 objectives today, and after every objective, I'll stop and look for questions, but hoping to wrap up in about 40 minutes, and then we can have a conversation if that is what this audience likes, or we can end early. Just wanted to wish you all happy Friday, and make sure that, and really thank you for coming on this Friday afternoon. It's not something that everybody looks forward to, is talking about data on Friday afternoons, but it is an exciting topic, and I'll try to bring some beach happiness to it. I also want to acknowledge before we get going that there's a lot going on in the world, and I want to acknowledge my privilege of being able to present this data, but also that it's been a really deep learning journey ever since I've really moved to the West Coast from Ontario and Quebec were my last 2 stops, and deep and learning journey about understanding the land that I live on and the communities that I live on and the people who were here well before we arrived. And that has just triggered this ongoing learning for my family. And then in the last month, that has been heightened tremendously with all the other events happening in the world. And so I want to acknowledge that whatever I talk about is not just about youth mental health. It's really in the whole concept of what social justice looks like, which includes environmental action, which includes health, which includes equity, diversity, inclusion, includes economic considerations. This all has to be considered together. And a lot of the outcome of this talk, if you leave right now, is really a call to action to bring all of these movements and people and silos together with a like-minded agenda to improve outcomes for young people and families. And I hypothesize, being a scientist, that if we can do that and we can focus on our investment of youth and families, that other things will fall into place quite quickly. the other thing to acknowledge is that who gets lost during these times is young people, and often young people or people who are marginalized and who are on the margins and suffering before all of this happened. And I also want to acknowledge in our own province of British Columbia, we've been touted as doing really well for COVID and taking a really good leadership role in the country of how we've managed this. But at the same time, we had more deaths in the month of May from the overdose crisis than we did from all of the COVID pandemic. And so we had 167 deaths up until the end of May for COVID. And just in the month of May, we had 170 deaths, and that did include young people. And so once again, our community has been rattled by this. So it's something that we can't just talk about in isolation and talk about any of these topics in isolation. We have to bring together the global picture and hopefully bring it together, driven by the needs of young people. And I'll explain a little bit more about that soon. So here are my objectives for today. And my objectives really are to describe the current state of how we're measuring outcomes for young people and their experiences in Canada. And I've put in beyond there because I'd like to give a little bit of an international perspective as well. I'd like to outline how Canada is responding to design youth-centered integrated health services based on the measurement needs of young people, and describe a CIHR-funded study that we had the privilege of being supported by to do that work. The third part is to really describe the health and social impact of performance measurement. And this is a bit of a new term for quite a few provinces, and I want to emphasize this term and how it's so critical and so important for leading the work that we're doing and bringing us together. And I want to bravely propose a sustainable plan to ensure that we are measuring outcomes well and the experiences well of young people, so that we can actually scale the really neat innovations that are happening across the country, scale them across the country, but also scale them in a global way as well. A few of you on the call have seen my pilot, but if you haven't, this is something just for food for thought and for consideration. Often when I bring this picture of the cockpit to presentations, I'm in a different part of the world, and the analogy is that when you're sitting back in the plane, or when we have that privilege to travel again, but let's say pre-pandemic, imagine when you're sitting in the back of the plane, you're very unlikely worrying about what the pilots are thinking about in the front of the plane. And one of the most important things that they're thinking about, the thing that you're unlikely worrying about, is that they're talking the same language with the people on the ground. And so the importance of the pilots speaking the same language to the air traffic controllers at the bottom is really quite critical. And there are intense consequences if the pilots were using a different language, not just in terms of English versus French or English versus Chinese or anything like that, but it's really the language of metrics and how it is important that they critically use the same unit of measurement in terms of airspeed, feet to the ground or distance to the ground. And the consequence of them using different metrics could be very fatal. So if a pilot was saying I was 100 feet to the ground and the air traffic controller said, no, you're 100 meters to the ground, that would be really detrimental. And so the analogy for this is that what I'd really like, and really the dream for me in my career and for many others, is that what if young people could walk into a clinic or a center or whatever it might be, and they walk into a place where they knew had the services that were going to help them, and that they knew that the language that they were speaking was going to be understood by the people at the back of that clinic, and that the back of the clinic understood the needs of that young person walking through, and that they were speaking that common language, and that there was full confidence that they were going to land safely in their care and in the experience, that they were to see the experiences that they would need. And the reality is we sit back in the plane, we never think about this small thing of the pilot and the air traffic controller having that same unit of measurement. But it really is quite similar in youth mental health in terms of young people walking in and saying one thing, but then reporting that they're getting a completely different understanding from their health provider, and that the care wasn't actually aligned to their needs. And at this time right now, there's very little infrastructure to be able to make sure that is measured, and that we can actually hold health services accountable, so that we're actually ensuring that our health services are matching the needs of young people and young people feel heard. And the rest of the presentation doesn't go back to this air traffic controller analogy very often, but please think about it. And if that's the one takeaway today, just think about the dream of what it would look like if you as a young person or you as a health provider really had this common understanding of young people walking in and a common language that you would fully understand their needs, and there was the full range of services provided at your center to support those needs. So objective number one is, what is the current state of measuring outcomes in young people in Canada? And so the opportunity, and this is, I'm going to do this a lot in the presentation, the opportunity versus the problems. The opportunity is that outcomes and data are important, and they're important to government, they're important to other stakeholders who are decision makers, philanthropists, they're important to young people, they're important to health providers, they're important to families. And so people are talking about outcomes. And so in my career, this has actually been a pretty dramatic shift. And one of the analogies I also give is when I was an occupational therapist and I was working in Kingston for many years, I had this bet with this nurse practitioner that I could take people out for coffee every day for 5 days straight during a work week and take 5 clients out for 5 days straight and write down that all I did, my intervention, was taking people out for coffee and no one would hold me accountable. And I did that, for 1 week. And then as a good scientist, I replicated that intervention and did it for several weeks. And nobody ever asked me what I was doing and why was that an intervention? Was it appropriate based on the needs of the clients? And that actually is what started my journey of going back and doing my PhD work and trying to figure out how do we measure outcomes for young people and for people who experience mental health and substance use challenges in Canada. But the opportunities people are talking about now, so that's exciting. The challenge is that the outcomes that we're talking about are actually not directly observable. So we can't take quality of life and put it on a bathroom scale and say you weigh 3 pounds of quality of life and the person next to you is 6 pounds of quality of life, and therefore they're twice as high on the quality of life scale as you are. It doesn't make any sense. And we also have outcomes that are being used, and there's measures that are used, so these questionnaires and these assessments that have been developed, and we're being encouraged to use them in the youth space, but most of them, if you look into their history, were never developed by young people themselves, and they've had the consequences are that we're using these legacy tools that have been deemed quote-unquote reliable and valid, but they have some serious side effects if they haven't actually been developed by the end user, who are young people. So how do we collect data in mental health? This is commonly what it looks like. Just give a questionnaire to people and we add up this total score. And then we anticipate that it actually leads to happy young people who are going to leave very satisfied because they filled in the questionnaire and it gave some information that we thought was relevant and we provided that care. And that's the way it's been done actually since the 1920s. And really where psychology started to develop patient-reported outcome measures or questionnaires to try to capture psychological constructs that weren't directly observable. But if you think about most of the constructs that we have in mental health and the youth mental health space, they aren't directly observable. So mood, anxiety, depression, function, pain, quality of life, recovery, these are all constructs that are very difficult to objectively measure and get a total score that makes sense. So we've been doing this and collecting a lot of data, especially in the last decade, but this is not actually leading to improved outcomes for young people and experiences. It's actually going the other way. And in the last 5 years, we've seen 85% increases in young people accessing emergency room visits because they're now talking about mental health, but they're not actually getting the services that actually meet those needs. And so although we're asking some questions, we're getting total scores that aren't necessarily leading to happier people who are connected to services. This is a common picture that I use from a town in New Cayman in South America, just to depict this further about what you do, and next time that you fill in a questionnaire to think really, really, really carefully about how the heck this data is getting used, how the data are getting used. Sorry, data are plural. So just for the fun of it, pretend this is a 3-item questionnaire that has 3 items, and this 3 items ask 3 things about this town, New Cayman: the population, the feet above sea level, and the year that the town was established. And what this town very cheekily does, and is one of my favorite signs in the whole wide world, if not the favorite sign, is it adds up these numbers. So this is a small town. At the individual level, item level, it tells us it's a small town. It's just above sea level, 2,000 feet above sea level. It's a relatively new town, which is interesting. But then they add up this score of 4,663. That makes absolutely no sense whatsoever. So this is a number that just they could add up. They had numbers and they were able to add that up, but that doesn't necessarily mean anything. And when you think about the number of times you filled in a questionnaire and then they add up a total score, this is exactly what's happening. We're getting a number that doesn't mean any sense from the pilot to the air traffic controller. If he told 4,663, that likely would make very little sense to describe this town of New Kayama. And I just want to highlight that we're not alone in health. And a recent, not so recent now, 3 years ago, but really outcomes in patients that aren't directly observable. Only about 11% of these outcomes were ever measured or ever talked to a patient, ever talked to the end user. And I use the word patient, just this is so they describe it in their study, but basically only 11% of all these tools that were ever designed or out there were actually done while engaging the end user, which is likely the patient or the person receiving services. And so it really brings this very important focus into the youth mental health space about this high pressure that we have to measure outcomes all of a sudden, but the recognition that very few of the outcome measures that we actually have were ever designed by young people or families. And what is the consequence of jumping into using what I call legacy measures, tools that are out there and they're on the shelf and they look okay, but they were actually not designed by young people. I'll give you an example of this for now. I have a love-hate relationship with this tool, with the Kessler distress scale. And so the love relationship is that everybody's using it. And this is a 10-item measure that captures psychological distress. The reference is down there if you'd like to get it. And that most of our integrated use health services across the country and the world are using this as a primary outcome measure. So the good news is that we have a bunch of people that are adding up a total score that is comparable. It's just that we're not quite sure about how that total score, what does it mean? What does that total score mean? The other exciting thing is that our Canadian Health Survey actually collects this data as well. So we have some norm data to compare against to look at the young people who are accessing our integrated youth health services and compare them to young people who are the norm population in our country, and to see how much more distressed people are walking through our centers compared to people who are not. So that's the good news, and that's really actually what you'd like to have, is you'd like to have some data that is comparable. But one of the important things with this tool is that if you sit back and you actually look at it, you go into the history of it, what you find out was that it was actually developed not for young people at all. It was developed as a pressure tool for the US government to have a population measure of distress for adult populations. So a group of people led by Kessler came together. They quickly did a summary of the literature. They came up with 600 items that might capture distress. They tested those items in a population of adults in the South Boston area who were primarily, who identified as Black or Latino, and they were on average 47 years old. And these items got quickly tested and brought from 600 plus items down to a 10-item measure tool that was used also at the population level. And then other countries thought this was a great tool too, and they started to use it, and that included Australia, which was a tool that started using it at the population level to measure distress. And then Australia, as many of us on this call know, are really leaders in the youth space and youth mental health, and they started to develop this new model called Headspace, and they wanted a way to capture the impact of Headspace at that level. So they did that, and guess what? They used the K10 to do that. And so all of a sudden, K10 quickly became one of the common measures used in integrated health services, but with a very little focus on the idea that, has anyone actually looked at this with young people? Was this developed with young people? And what are the consequences of using these adult-based tools to be able to inform the effectiveness of our services? The other thing to just note is that there's very limited involvement of measurement experts in the work that we're doing. And so it's really important to have young people, but it's also really important to have measurement expertise at the table as well, so that we could have probably picked up this potential challenge about 10 years ago if that was there. So it's not just bad news, it's the opportunity that we are growing as a country in knowledge of youth engagement, and really extraordinary leaders that we have that have come out of groups like AIM and Youth Wellness Hubs Ontario and Foundry and Access about what does youth engagement look like. It's not just having people at the table as a token at the table. It's really a range of opportunities, and then how does that look? And I think that Canada is really leading in this space more than any other group in the world. And the opportunity also is that the measurement science has changed significantly in the last 5 years, and it's dramatically changed things that you probably don't know about. It's dramatically changed the economy. It's dramatically changed education and how we give tests to students and compare students. And it really needs to dramatically change health as well. And so there are new approaches, and I think there's new opportunities to bring these two innovations together and be quite creative in how we measure outcomes for young people. So the question is, why create a pan-Canadian data system and measurement? So the idea is that it's almost like we don't need a system yet. We need buy-in to the idea that we need a system. And I think we've gotten there, but we need buy-in to a system that needs reform. And this is a quote from William Fisher, who's a colleague of mine from UC Berkeley. And what he said is, you need a system that identifies and uses the new kind of thinking needed to solve the problems created by old kind of thinking. And one of the challenges of doing that is recognizing, not throwing old kind of thinking under the bus, recognizing the strength of that thinking, but being able to shed light into the new kind of thinking and how it can be really value added to our system. This pan-Canadian idea really also goes back to that first slide of aligning with all of the things that are happening in the world and the values that we have and that young people have. But we can't just do this alone. We have to align the social, moral, financial, and scientific values to align and drive youth-centered and family-centered innovation. And my last point is for sustainability. And I think in terms of integrated youth health services, there's an opportunity to use data to really make a market for sustainability. And the market has to be based on the needs of young people. And that's what really the next part of the presentation is about. It's about really focusing on what is the value add of driving a system based on the outcomes that are important to young people, in addition to outcomes that are important to government. And what is the consequence if those aren't aligned? So I just want to look at my other screen. I'm not looking away from you. I just want to make sure there are no questions. I think we're good to go. So I'm going to go to objective 2 now. And objective 2 is how is Canada responding? And this is a painting from Robert Olley from 1940 that depicts a lot of cooks in the kitchen. And I'm not going to say too many cooks in the kitchen, but I want to say there are a lot of cooks in the kitchen. And I think it's important to historically understand this. And for Alberta, coming into this space right now with integrated health services and really with that great opportunity of being a centralized health service and a health authority, like just one BC, we have 5 health authorities. You really have one standard one. This is such a great opportunity to think about how do you have the right cooks in the kitchen who are working together and not working on top of each other. But just to know the history of, and sort of the landscape of where we're standing. This is really in 2015. This came out, which is from the Mental Health Commission of Canada. That was really our first sort of push with the youth space of informing future mental health indicators for Canada. And they came up with this indicator document that highlighted indicators that we should be sort of capturing across the country, and it included a specific section for young people. And then shortly thereafter, and if not right aligned, we had this initiative of the Integrated Youth Health Services Initiative, starting off with Access Open Minds and Youth Wellness Hubs Ontario and Foundry in BC, coming to the idea that we could provide a service that responded to these indicators and responded to the needs of young people. And then really luckily, these three organizations and with support as well from Alberta, one of our colleagues from Alberta joined on this grant, and we received this great grant from CIHR to come together and to work and define this common set of indicators for youth and a way to measure that. But at the same time, CIHI, the Canadian Institute of Health Information, and StatsCan, we're also doing this separately. And then our lead organization for knowledge exchange for Canada redefined its overarching priority, and their #1 mandate was a national data collection system for youth. And at the same time, and this is a bit of a story that one of my Swedish colleagues pointed me to this extraordinary work that was happening in Canada. I was like, oh, thanks, it's our Access Open Minds grant that we received through CIHR. And they said, no, it's the positive health impact surveillance work that PHAC has done, the Public Health Agency of Canada. So they came into the picture, and to complicate it more, there are extraordinary groups across, especially groups led up in Northern Ontario, who are doing incredible work with First Nations, Métis, and Inuit communities to measure the needs of young people. So the good news is there's finally an investment in this area. The opportunity is that there's funding and there's strong support and there's strong clinical support that we need to do this. But there's also a significant risk. And the risk is that these activities are currently siloed. There's not a lot of conversation happening between the organizations. And by the organizations, I mean, really, in looking at the government level, I'll explain in a few seconds, but when there's federal investments happening, provincial investments, regional investments, local investments, these organizations are now not talking the same language, and they're all working towards different indicators, and this creates a tremendous risk, which we've seen many, many times in other health jurisdictions, of not leading to poor outcomes, and also very high cost of sometimes having to peel all of that activity back and bring it together. And so we're at this phase right now where all these activities are happening in silos, but we need to actually be able to be intentional about how they connect in together. There's also the risk right now of these activities being funded, but not being, and I put youth in all caps on purpose, not only not involved, but really, like, youth have to be at the table as core decision makers in all of these initiatives. And there's been a couple of examples where that hasn't happened, and we need to bring youth and their families, however family is defined in that organization, together. And there's really intentional opportunity to have to also have First Nation, Métis, and Inuit leaders at the table, including as well diverse groups that represent Canadians. And especially with the events happening in the last 2 months, it's not even negotiable about how we do that and how we do it really well. I've also included the risk of not including community organizations, and a lot of nonprofit organizations are funded, on these very task grants, these siloed short-term grants, and they're constantly fighting for these grants to stay alive. And there's a really big risk that they're not also measuring the same outcomes, or that they're not supported by groups like these larger groups who have been funded to do this work so that they can capture the needs of young people. I've talked already about the lack of measurement expertise, and that's a really big risk of not having measurement experts. And I'm going to now move to talking about the risk of a top-down approach rather than a bottom-up approach, and what happens when we're not accountable to the investments that we're making. And I can't stress that there's been no investment in youth mental health outcome measurement ever in my career that I've seen really until 2015. And so we have an accountability of this investment and making sure that that is meeting the needs of young people first and foremost. So I'm just going to go back to somebody said objective 2 is too small to read, but basically it's just how we're responding right now. This is the purpose. Okay, so on the right side, this is from the brain of Skye. And if you know the brain of Skye, it's always thinking, but always open to different suggestions, and very happy to receive more suggestions in this area. But the blue top-down approach, it's intended to really emphasize how this funding gets put together and what are the needs. So we have our Government of Canada, and embedded in that is the Ministry of Health, and embedded within the Ministry of Health is Health Canada, and underneath Health Canada we have PHAC, the Public Health Agency of Canada, StatsCan, CIHR, other tri-council organizations, who somewhere in there will decide that youth mental health is important. And within youth mental health, who might also feed that information to the provincial government, who might see that's important. And the provincial government might feed that off to different regions within their province, and I tell them that it's important and they should do something about it. And then different regions might start working in youth mental health spaces or health spaces. And we hope that there's an impact, and we hope that that impact can be fed up to the government of Canada. And I'm just going to skip a slide for 2 seconds and just show you the blue of how that looks in terms of there's a budget, and the outcomes using that top-down approach are really focused on the number of people receiving services, the types of services that are funded, the impact of those services, which impact in quotations is there on purpose because it's usually the number of people served, the number of hospitalization visits avoided, the number of emergency department visits avoided, etc., the number of dollars saved. And as you go down towards where the province is trying to work, they're trying to identify who's getting services. And then some really unique regions might say, hey, cool, look at us, look at the great work that we're doing. And then young people might just still be walking around saying, where do I get services? And reporting that experience of feeling lost because there's multiple services and it's hard to navigate. So going back to this blue slide, the lighter blue slide of looking at how do you actually go up and how do you do a bottom-up approach, and what would that look like? And what that would look like would be actually talking to young people and families and asking them, and communities, I'd say young people, family, and communities, and asking them what their needs are and how they define health and mental health, how they define health and wellness and quality of life. And then it would move up towards making sure that we'd understand the diverse needs of everybody and as much as possible, and making sure that we're intentional to ensure the equitable, diverse, and inclusive processes to make sure that not just those typical people come to the table, those engaged, well-resourced young people come to the table, but that all people have a voice. And that's really tricky work to do. And then we want to move up to making sure that there's timely access to care and finding funding for the infrastructure and technology to identify those needs and be able to build the resources to actually meet those needs. And there, at the top of the bottom-up approach is where we measure the impact. And hopefully that impact is actually based on the needs of young people at the bottom. And my proposal is that in order to move forward, we need to actually bring all of this together, and we need to actually bring the needs together, and they need to start talking the same language. And this is our pilot, and this is our air traffic controller right now. And right now we have a situation where our pilot and our air traffic controller are not speaking the same language. And the outcome, and so I said to one of my colleagues today, well, it's not fatal. And they said, of course it's fatal. You have 1 in 4 young people who are affected by mental health challenges every year in your country. And the outcome, there's no other health condition that's like that. And so we have to start really saying that this is a high risk of not talking the same language. And maybe fatal is the wrong word, but it's high risk for young people for their sustainability of integrated health services and for the health and outcomes of those young people, that these two ways and approaches are not speaking the same language. This is just, again, this is really how they're measuring the outcomes, and you can look at this on your own time, but really the emphasis is these are the needs of young people. We should be measuring the systems based on their needs. These are the needs of government, and this is what ends up happening is young people feel a little bit lost because they're not feeling informed, and it's not their needs driving the services. But again, how do we bring it all together? So how is Canada, or how has this led to Canadian innovation? And I think there are 3 organizations right now at the forefront, but there's a lot of organizations, including amazing work that's happening in Alberta, and we're really excited to see and to support and to see what they're doing. And I think what these 3 organizations first and foremost have done is talk to young people. It doesn't sound like rocket science, but they've talked to young people and they've asked them what their needs are. And they're building services that are youth-centered and based on the needs of the communities and the young people and families who are living in them. And so they're taking this bottom-up approach, but they're also in a very sophisticated way constantly talking and building relationships with a top-down approach, which in the end is that funder and is really responsible for maintaining the outcomes over time. And so this is quite a critical relationship and quite a sophisticated dance. And the leaders of these organizations have really become skilled at doing this and making sure that the agenda of youth and families is at the forefront, but that government understands how this potentially could lead to a better investment and value add long term. Okay. I still don't see any new questions. I'm going to keep going with objective 3. If you put them in, I will address them, but I just want to recognize the time. I always worry I don't have enough time, and here I am running out of time again. So objective 3 is about performance measurement, and this is a little bit novel and a little bit out of scope potentially for this talk, but just I wanted to throw it out there and see if it sticks for this audience. But I think if I was starting off again in a position that Alberta is currently right now, a very excited new investment in youth, I would probably push this agenda a little bit stronger at the beginning, because this is really how a lot of companies around the world and other systems of care are starting to work. And I think in Canada, we have this benefit of being a socially just system where young people can access care free of charge and any kind of care for Canadians. But we have to start thinking of ourselves a little bit more as a business, and how do we actually provide that optimal customer service experience for our patients and for our youth and young people that walk through through different organizations. And that customer service piece seems weird because it doesn't often fit with health. And customer service, if we were thinking about a business, we'd want to see the performance management of that business. How is it actually performing in terms of what its vision and mission and mandate are? But we have a really strong collective mission and mandate for young people to improve their health outcomes. And therefore, we need to be starting to think about, are we actually providing the right services to youth and families? We have to be working with them, really co-creating what this looks like together, and making sure that we're accountable if we're not actually doing it, and we're not, maybe we're doing it well now, but maybe we're not doing it well in a couple months from now or a year from now as the needs of youth change over time. And no better example than the last 3 months of seeing how rapidly needs of young people can change. So performance measurement is actually the process of collecting, analyzing, and reporting out on data that is important to the end user that you're talking to. So for us, it's young people, families, and systems, and I'll explain that in a second. But it's really, the emphasis is that it's not about just collecting data. It's not about collecting data. It's about actually building in the infrastructure to collect the data, analyze it in real time, and make sure it gets back to the people that are going to be using it. And the people who need that data are the youth themselves and their families. And if we can design systems that actually are reporting out in real time to them, then we can always feed that back to the top levels of government and to the decision makers. But it's really important that we first and foremost think about, how do we actually build a system of collecting and analyzing data that gets the data back into the hands of youth so that it empowers them. And that really is when you get away from creating just a data collection system versus actually developing a system that works, where you're giving data that empowers clients and empowers the people who are actually using the services. So performance to systems, I think it's really important to know how that looks. And so again, that's that blue triangle of importance to systems. This amount of dollars spent, often reported out as percentage GDP, number of Canadians who saw a health provider, ED visits, hospitalizations, wait times, access to care. And there's more and more focus right now on who's accessing those care, and the importance of actually collecting the data about race, about gender, and about diverse social determinants of health, to make sure that we understand who's accessing the systems. But when you ask what performance means to young people, this actually means something different. It means that the system is helping me make sure that I can maintain my relationships with my family and friends, that I can participate in meaningful activity that's important to me, which includes school, art, work, and that I can be independent and have strong physical health. When you ask young people this, physical health is still very important to them. And they also talk about, contributing to my community and be able to make sure that I'm an active member of my community. And young people also really care about their friends getting help where and when they need it. And so a really good system doesn't just mean that I will get the services. When you ask young people, it actually means that their friends will get the services as well, and that they feel like they collectively have the resources they need to thrive. When you ask what performance means to, oh, I apologize, this should say family at the top. It really talks about the intention that my child is happy, that, or, and again, how you define family. So it could be a child or my friend is happy, they're thriving at school or in work, if that's where they're at. They have friends who respect them and who they feel safe with, and who can be their honest and genuine selves. They're happy. They can also talk about their own sense that I can go to work now and worry less about my child and spend time with my friends and do the things that are important to me. So an ideal performance system and a measure has to meet all of these needs. And it really has to be, in my opinion, youth-led, and has to be at the young people at the front end of it leading. And on all of the things that are below this are really things that people like I myself worry about in terms of reliability and sensitive and actually can predict outcomes. But we have to actually, as psychometricians and people that are working with the data in my team, we have to be making sure that we're confident that we're working with data that is important to young people, actually developed by young people themselves, and that the measures are good so that we can actually do this fancy stats work and make it look good. And just as a flag, there's lots of fancy stats work out there. And every time you see it, before you get excited, go to the front end and see if young people are at the front of this. Because if not, the reality, and here's a secret maybe I'm not allowed to share, but the reality is you can do anything with stats to make it look pretty. And so a lot of people get really excited about a lot of stats and a lot of modeling, but they don't actually ask the question, is this important to young people? Were young people involved? And that's where we have to go first. I'll give a couple of examples, just as a little show and tell for the last 5-10 minutes. This is Foundry. This is the organization that I am a part of, and that several people on this call have been really fortunate. I've had the privilege of working with and starting to get this up and going. This is one of the one-stop shops for young people across Canada, and the outcome is where wellness takes shape. We've had a big announcement in the last week that we are expanding. So we're currently at 8 centers operational. 2 will be opening in the next month, and then we'll have another 8 coming on board right after, for a total of 19 centers. And we collect data in a very centralized way. So we have a centralized data collection system called Toolbox, and it includes all these demographic variables, but also outcomes that are important to young people and have been not only identified and tested with young people, but when the cases that we don't think that they're actually measuring something important to young people, we do that work with them alongside to make sure that we're creating the outcome measures that are fit for purpose for this context of use. This is my daughter's birthday this week, so I just thought I'd put this in to describe it. Here's Kiss, and here's her, here's Toolbox in one of our centers in Abbotsford. And this is basically what it looks like, that we have young And so it's anticipated that we not only just see this data coming out of number of unique service visits and total visits, but we also see the things that are important to that client when they're walking in, and that care is contextualized in the context and what is important to that young person, and not just what is broken at the level of the brain or genetic or cellular level. It's much more driven by strength-focused needs of the youth themselves. This is, I'll share this slide deck and stuff that we can have. And this is really the CIHR SPORE funded study that allowed us to be cheeky and just stop everything we were doing and say, if we're going to build this system for young people, we really need to actually stop and ask them what's important to them and ask them how they define health. And so if we're going to build a health system for young people, it has to actually be based on how young people define health themselves. So the intentional idea was we'd have a young person walk in, there was a Foundry, and they would fill in some data and they'd be happy, but we realized that that's actually not the case, and that we really had to flip it around, because this is what was happening. We were getting a lot of data with total scores that meant absolutely nothing. Versus putting young people first and asking them what was important to them and building the tools that were important to them. And this is how it's worked for us. That has been a lot more intentional in the work that we're doing, and much more creative. So let's just skip forward a little bit about how this looks. And so, the idea, we just wanted to ask young people, how is health defined to them, and what did that look like for you? And we asked young people, not just what health looked like to you, but how do you go from low to high health? And what is the worst possible health imaginable? So one of our focus groups looks like. What is the best possible health imaginable? look like, and how do you go from low to high? And we had youth individually in groups and focus groups come together and do this and flesh this exercise out over and over and over again, until we started to build up these measurement hypotheses about what it actually looked like for young people to go from low to high. And what I mean by that was that at the low end of health, we had these very strong indicators about what that would look like at the extreme end. We had indicators about what it looked like at the middle end, and then we also had indicators at the high end about what high health meant. And then what we're allowed to do is, like, the cool part is when we start to conceptualize what this looked like and what all these sections look like, and we call it the red, the yellow, and the green zone. They're able to go into centers now and actually work with centers. And this is super, super teeny, and it's not intended for you to read, but it's super, super teeny. But what we're allowed to do now is it creates this language of conversation. So if a young person comes in and they're identifying that they're in the red zone based on the metrics that we're collecting, what is the role of the person at the front desk when they flag as red? What is that role of that first person? Because that's often the first person who they see. What is the role of the peer support worker? Because that's often the second person they see. And what are the roles of the multiple stakeholders within the organization? What is their actual response? And when you start to have many different organizations providing this level of care, it's important that we have this language. And it does create a language not only of what the services are that are available at your center, but also it creates language of accountability. What if the person came in the red zone and these services weren't provided? Who's accountable in that situation? Something that makes me more excited is that 95% of our healthcare budget is invested in young people in the red zone. And what we have is we have a lot of young people clearly describing what the yellow and the green zones are. And what is the intention of what is the risk of not investing in these areas? What is the risk of not providing services in these areas where a lot of our young people want to be? So if someone goes from red to yellow, how do you actually provide those services to keep them there and moving towards the green zone? And who is involved in that care, and what are their roles and their responsibilities? And so what you do is you end up creating these rulers of services. And I just use the raw streetlight example. But if you end up having an organization that 40% of your youth are red, 40% are yellow, 20% are green, you can start to create goals for driving your services to try and move people out of red. Because if 95% of your budget is only directed to the red zone, you will only have young people in the red zone. The idea of investing up in the ruler, and we need a stronger case for that, and measurement is really, really important, because we're only measuring those outcomes that are the top-down approach. If we start to measure the outcomes that are important to youth and families, then we can start to shift a little bit and start to show performance metrics. And this is an example of one center on Vancouver Island that did exactly that, and they've moved from a 40% in the red zone to 20%, and more of their patients are moving up the ruler. So it's quite exciting to see. So it gets away from this concept of the traditional top-down metrics, which are important, but more towards the new carrots and I like my happier donkey, to things that are important to young people, and the new carrots, and driving a system of care that's based on these needs rather than the traditional top-down needs. I want to just skip this section, but please read these. There's lots of nice quotes that come from this study. And I'm going to skip this too, but really want to talk about objectives 3 and 4, about the health and social impact that this is having. And when you have this ruler concept, the idea of understanding how young people go from low to high, and you understand but what the outcomes are that are important to young people, and you understand not just the outcomes at the low end, but the full range of needs of young people in your community, it then gives your funders and your organizations a lot of idea about how to invest along the ruler. And it gives much more clarity about where that investment has to happen. But you have to have the conversation. You can't invest just because there's money at the top and it needs to go somewhere. You need to invest based on the needs of youth and families and communities. And that has to happen by having a conversation of how you go from low to high. And this is really where the measurement science has improved so much in other sectors. And it's not really rocket science. It really involves buying a 33-cent ruler, 3 for $1 at the dollar store, and having these conversations with the organizations about how young people go from low to high. What are their needs? What are the services we provide along those needs? Where are gaps in services? And how can we fill that? So my plan moving forward, it could be a little bit cheeky or high risk, but hey, let's try it, and happy to have a conversation. So my plan and the ingredients for this plan is really that that young people have to be decision makers at the tables. We have to have not young people at the tables, but they have to be at the tables for making the decisions. And they have to be equally able to participate at these tables. And there's a couple of my colleagues, Nancy Zhao, who's on the phone, who's on the call right now. And I think just learning from Nancy and learning from other like-minded people is that this takes skill, and it takes actually skilling up and resources to make sure that young people feel that they are skilled to be at that table and that they can participate. And one of the higher risk things, I think, is that when we're at these tables, these often happen in very closed rooms that aren't accessible. And I think we need to actually start to make these decisions much more public facing that happen. So if young people say X, Y, and Z is important, but the decision that comes out is A, B, and C, that needs to be public facing, and someone needs to ask the questions, why is there misalignment? For integrated health services and measurement, the tables need to be coordinated, and this is the example of the too many cooks in the kitchen right now, as do the funding sources. So there's a lot of excitement that it's important to invest in outcomes, but there's a lot of people doing a lot of work in separate corners, and we need to have a way to intentionally bring this together. We also need to start to get outside of our little health box and to leverage technology and different resources and skills to make sure that we have a data collection that is platform that is youth friendly and that can quickly mobilize the data. And so that doesn't mean our traditional health way of getting data in a place where it's kept and then we can look at it once a year with the government. It's actually data that comes in and gets out just as fast as it comes in. So that's in the hands of youth and families so that they can feel empowered, or in the hands of centers so that they can make decisions about the innovations that they're doing and make decisions about the clinical services they're providing, so that they're constantly focused on the needs of youth and family, not constantly focused on funding and getting dollars from the government. And and I know that's just as important, and that's why we need both triangles, but it's really easy just to go to the top-down approach and lose sight of youth and families. So youth are at the front, at the center of everything that we do, and there's lots of like-minded organizations, and Alberta Health Services is going to be right there and leading the way, and really excited about the work that Pam Liversidge is leading with her team and others in Alberta right now that are doing amazing scientific things to bring the science to a much stronger state so that we can engage in this dialogue. This is the last picture that I think I want to share, and I think it's an important story, especially for the stages that we're in right now. This is a story that was shared to me by an elder in Winnipeg, and very thankful for that story, but he shared it to me in 2014, and it becomes much more applicable every year that I think about the story and then I retell the story. And so the story is about a community, and the community had a problem, and the problem was that young people were falling off this cliff because the community was a beautiful community, but it was built on the edge of this cliff. And they had this huge problem because young people are falling off the cliff. And so the story says that a whole bunch of elders came together, and people from diverse communities came together with health authorities, and they had a conversation. They went away for 5 days, and they came back with a solution. And the solution was that we're going to build a hospital at the bottom of the cliff. So rather than thinking about what are the needs of young people and moving them away from the cliff, or moving preventative measures to keep them safe and healthy and thriving away from the cliff, the concept was that we're just going to build another hospital around the bottom of the cliff. And I think the elders' lesson was to think about that, and to think about these are our traditional ways in which we've been building systems without really thinking about what does it look like? How do we think about the full range of needs of young people? And how do we actually build a system of care that is based on those needs and allows people to thrive rather than keep falling? So for that, I'm going to say thank you. And I will try and navigate this question thing here on the side and see if there's any questions in the chat, and also open to any questions as well. If you would like to unmute yourself, I'm happy to take those, but I'll just go through the questions right now. There's lots of individual chat with each other.
Skye,
Hey.
it's Amber. I'm just going to chime in while you're reading the questions.
Sure.
And I just wanted to let all the attendees know that there is a session recording from earlier in the week about Alberta Integrated Youth Services. So
yeah,
that might be of interest for people to look at the recording. It's on the Mental Health Foundation YouTube channel. just to get an idea of what's happening in our province relating to what you've been speaking about.
Sure. So, and thank you for referring, and thanks to Pam Liversidge for clarifying that slip that I made. And so please refer to, I heard that was an amazing presentation, so please see that. Amber, there's a couple of questions. Can I answer them directly? Do you mind?
Yeah, that'd be great.
So a question from Selena, that the ruler outcome measurement system you folks are using is awesome. My question is, rolling up across the province, across Canada is a good idea, but how would you intend to capture the nuances across the provinces or even within provinces? So this is a great question, and this is where the measurement science becomes really important, is that you really want to make sure that your ruler is as robust as possible, but also meets the needs of the most number of people. And I guess the nuances is either referring to the, let's say, systems thinking, but also the individual differences that are across the country and across the system. So we want to make sure that first and foremost, we're talking to as many people as possible, as many young people as possible, and getting diverse voices. And there might be different rulers and there might be different ideas, but it seems to be no matter what country and no matter what group that I speak with, this traffic light analogy tends to work and tends to have a very nice ring to most places. The ruler thing seems to work as well. The only my biggest learning is with a lot of First Nations community. They like the ruler concept, but they much prefer it in a circular medicine wheel type of conversation. And so we've still used the colors for many organizations we've worked with, but it's in a circular fashion. So there are various nuances, but unless we actually start to ask young people what's important to them, we won't actually know what the differences are across the province. And I think that's quite important. And Hammer, Pam is excited about it. That's you can read her quote. Thank you, Pam. That's very nice. Any other questions? All right, I'll be happily sharing my slides and really happy to have a conversation to anybody who wants to talk about rulers and talk about measurement. And we're so excited in British Columbia to see the work that's about to happen in Alberta, and the leadership is tremendous and the ideas are tremendous, and really, really thankful to be able to have that opportunity to learn from each other and across the country as well. But really, really, really excited about our neighbors to the right of us and what the work we're going to be able to do collectively. But it's really important we speak the same language, and it's really important that we work together, and there are many barriers to doing that systemically, but it's intentionally, if we put the needs of young people and families right at the front, I don't think we'll go wrong. I think as long as we're being led by them and being led by their needs, we'll do really great work. So I'm looking forward to the next year, and very thankful that 2020 came so that we could have some time to think intentionally about this work and do it very well. On that note, I'll be signing off and wishing you a very happy weekend.
Skye, we just have one last question.
Oh no, that was my big.
It was so good.
You're not getting a pep talk for the rest. That's it. Sorry, Michelle. I work on. Is that the one you're referring to?
Yeah.
I work on family use crisis. Many of our patients are involved with child protection services in some way. Are they a stakeholder? Absolutely. Absolutely. Yes. Plus. So, and I think one of the learnings of British Columbia is that bringing in, they often tend to be they tend to be very specialized in their own service area. But the youth tend to age out just because that's what happens. People age out. And so we need to have a really tight communication system. And I've lived in 4 provinces, and I've never quite seen an exemplar of this working very well with child protection services or ministries of family development and health being totally connected in. But the reality is that we need a cross-ministerial approach and a cross-service approach to come together. And we need to, again, think really creatively about how do we intentionally create space for these organizations to be at the table and feel like they have decision-making power at the table, and that it's value added for them to be there as well. And that is one of the things that we have to do, again, from a customer service perspective, about thinking about the value add of bringing them all together. And I would argue that there's so many different organizations that need to at the same table, but we have to also realize they're all fighting for the same dollars, and they're all they're pretty siloed off intentionally in how the system's been designed. So we really have to be a little bit audacious and brave and bring our organizations together, but be very clear about why we're at the table together, about what the roles and responsibilities are of everybody, and what is that shared vision. And again, if they're there at the table, and youth are at the table, and youth with lived and living experience of being in child protective services, I think it would be pretty groundbreaking and quite an opportunity to do some great things moving forward together.
And Michelle, I would add, if you're still on the line and you haven't connected with Pamela yet, it would be really great to connect and talk about that for Alberta Youth Services.
Great.
Perfect. Okay.
All right.
Thanks, Skye.
Thank you so much, and wishing you all a great weekend.
You as well. Okay.
Bye.
Bye-bye.